Let's look at the today of the operational management. In planning, we spoke about strategic management, and then that's a long-term one. Then short-term one is the operational management. Let's talk about operational management today. What we are going to do, if you are going to have a strategic plan, for you to put it into practice, you will have to you divide your five-year strategic plan into annual basis. Now, year 1, year 2, year 3. So for to do that, you have to have a develop the policies, right? From the strategies, you have to develop the policies, annual policies. So what we do is we do the policy development, and then we do organizational design. We will put people there, here and there, and then we look at quality management. For you to, when you are trying to work, you have to have quality management and you have resource management. We will talk about this as we go on. What are the policies would come under methods of the resources. We spoke about resources. Now we are managing those resources annually. It's called operational management, right? If you really look at, if you think back, what do you think about your nursing manager, your nursing sister? If you draw a picture, what will you see? Right? Now what you will see now is that you're in charge, or the tutor is writing all the time, heaps of books around and covered with books or inventory books, this and that. Was the modern manager, nursing manager, should have nothing on the table. If your operationally sound, you will not have anything in the table. Whatever you get, you sign and send. And you will have, in your background, you have nice pictures, right? Inspiring pictures, inspiring quotes, inspiring ones at your side, as well as you have the forecasted ones. Now, forecasted ones, what are the, how many patients you had, how many patients you are going to have next year, not only had. Now, why we have now if you go and see, now we have how many patients, the midnight total, and past details. Past details is good to have, but what is the future details? If you are a good operational manager, you should be able to predict how many patients are going to come. You should be able to predict how many nurses you need, and likewise, the predictive forecasting has to be done. Now, what is operational planning? Operational planning is a process of giving desired output and outcome. We spoke about it before. It's a management process of the services production ensuring the desired output and outcome. Example, examining and treating 100 patients in a hospital within 6 hours with a cash flow of 40,000 if you are in the private sector, or the cost of 40,000 in the government sector, or while satisfying 80% of the patients. So this is a operational planning. This is what you really do. Let's do it. Let's look at the responsibility of the hospital, or the CEO, or the nursing manager, or the CNO, right? And then let's look at how to move forward. Now, if you look at the definition as per se, it's a management of systems and processes. You have a different systems. You have a nursing system. You have a doctor's system. You have the patient care system, right? And the processes, each one, each area, you have input, you have a process and the output. So let's look at basically, now when you look at what we do is either we will produce goods or we produce services, right? Goods or services. In a hospital, we don't produce anything, but we do the services, right? Now, what are the differences between the goods and services? It's there. You slowly look at it. What are the things in when you produce goods and services? Goods are tangible, services are intangible, right? And the customer contact is very high in services, and labor intake content is very high. Uniformity, the input is high. Uniformity input is low, right? And then measurement of productivity is difficult, and then opportunity to correct and problems and before delivery is very low. When you go there, only you realize inventory is very little, and the wages, the wide range, because doctors, nurses, all are involved, and the patentable. Like patent is when you have a good, you can say it's mine, but services are not usually patentable, right? If you look at the goods and service industries, as you can see, from 1940s to 2000, you would see more and more services are going up, the goods are going down, good production. If you look at the operational planning, this planning function involves converting input to output. You transform inputs, right? Labor, land, capital, whatever, to transform in this process to an output. So that's why you produce goods and services. Even though if I say we don't produce goods in the hospital, some might argue and saying, why in the labor room there's a baby coming? No, that's not goods. That's a part of the services. It's goods are the ones that you produce in a factory. You get the small items and produce a bicycle. Likewise, then what we do is once you have this, we get a feedback to we need to control this whole process. So we have a control. We look at how many, we go and monitor them, all that. And then finally, is there a change you need? If you have too many nurses, you will sell them, reduce the nursing. If there are too little nurses, you ask them to have more nurses, likewise. Then if you look at the transformation, if you look at different ones, hospital, restaurants, all these things are there. Hospital, what we do is we have a patients and medical supplies are the input. Then we have components that resources needs, doctors, nurses, and the equipments and the facilities, etc. And then we transform primary transformation function, healthcare. It's more of a physiological transformation. And then finally, we will get the desired output. That's the healthy individual, right? We have ill patient, we transform them to well patients, right? So these are the ones that you really do in a transformation process. You not only need human resource, you need the finance, you need your purchasing, supply chain, or the drugs, and then you have to promote. Sometimes marketing is needed, and then suppliers, and then the customers, right? We'll skip this. Now there are two things like value addition. So not-profit organization, they don't take a profit. They put whatever the profit, they put it back. It's called a non-profit organization. And then for-profit organization, they take a profit, and then of course they pay, and the owners will take the money out when they want. Then let's look at the health services operational planning process. Now, what are the things that for you to produce high quality healthcare, what you have to reduce the risks. When a patient comes into the hospital, until he goes out, there's a maximum risk. That's why when somebody walks into a reception of a hotel, they would ask, "Can I have fun today?" The receptionist says, "Yes, sir, you can have fun. You can go to the pool. You can go here, go there. You can go to the bar. You can go swimming. You can go to the beach. You can go for walking, etc." Very confidently they are saying. But if the same person goes into the hospital reception, where the nurse is, would ask about, "I'm coming for this surgery. When can I go back?" Then they have a small pause and would say, "You can go in 2 to 7 days." They won't give an exact date. So that's because there's a lot of risk in these services. So your risk minimization is very important. Then you have to satisfy the patient. Very difficult to do because patients would have needs, but we would give their wants. The patients have needs and wants both, but we can only accommodate their needs only. Because, for example, chest pain need a treatment. We will give a treatment. We will check that's a need to treat the chest pain. But he wants to do a cardiac echocardiogram. So you would say no, it's not necessary to do an echocardiogram. So needs and wants. So patients, it's very difficult to satisfy in a healthcare environment because with our regulations and policies and protocols. And then once you go off after operational management, you have to create a bonding, ensure the repeat customers. The patients will come back to you, right? Then promote, and generally they promote word of mouth. That particular hospital, there are excellent nurse. You should go and meet her. She will help you. That kind of a thing. And internally also, doctors and staff and the whole team should be very happy and working together. And then in a typical hospital, we really have to look at high asset utilization. that in simple words, you shouldn't have empty walls, right? You shouldn't have empty theaters. You should have always try to utilize the facility 24/7, simply because they are very costly equipments, very costly environment. So you'll have to really utilize and serve patients as much as possible, because equipment will discarded after 5 years anyway. You have to get another. So if you keep it idle there, what will happen is that's the cost for the organization. So productive use of human resource and supplies. If you look at the nursing professional today in South Asia, majority of the time you'll be duplicating the same work over and over again, like counting drugs, writing so many books and books and books, right? Those are totally unnecessary. That's outside the nursing care. The nurses are supposed to give nursing care, not doing all clerical work, all that. I mean, if you realistically say, the policies has to change in this regard, and produce a cost-effective services. Services will have to be cost-effective. If you look at the government sectors, we give the free health care. It doesn't mean it comes free. The money comes from the taxes, the indirect taxes and the direct taxes from the community. So nothing comes free. There's nothing called free. It's a free at the point of delivery where you don't charge from the patient. But patients are paying indirectly. Every time they have a tea, every time they buy a loaf of bread, they are paying your salary. So therefore, and then it's our responsibility to make these services very cost effective, right? Give it at the cheapest price, cheapest cost. Don't waste stuff. Don't waste equipment. Don't have idle time. Don't look up and wait. Those are the things that we have to really look at. And then, as I told you before, it's very important to manager to forecast, tell about the future. Now, you have to down. It's a rainy season. You'll have to really look at how many dengue patients are going to come. So you have to get ready for it, because otherwise it's always like a casualty day. You don't know who will come at what time. So you can't wait, look up and wait till the patients come. You should predict and have the staff ready. Every organization. That's an excellent operation management. And new product development. What can you do? Now what we do in most of the time, we wait till the patient gets sick. So when they come, we try to cure them, right, or manage them. Why can't we go out there and do preventative care? Why don't we do preventative care? Now look at the COVID crisis. We excellently manage the thing because we have a lot of preventative work, right? So why can't we do it for the others? And the systems management. Now the whole health system. There are, if you look at the smaller hospitals, they are highly underutilized. Only about 20 to 30% of patient utilization, bed utilization. If you go into the high-end hospital, like a teaching hospitals and a national hospital, it's highly utilized. More than 100 beds are utilized. Ideal hospital should have 80% of the bed utilized. 20% of the bed should be free. That's the ideal. Because we always wait for emergencies and others to keep that space. So therefore, the whole system has to be managed. Whole system has to be managed. Now we produce doctors haphazardly without looking at the forecast. We don't have enough nurses, right? We don't have enough some other allied health science professionals. So it's the whole system has to be revamped. Now most of the money that we the money is going to manage the administrative sector. Now if you really look at today's look at that how COVID has controlled us. Now, generally, typically, being a medical administrator, we used to come 7 times to the Ministry of Health. There are 200 doctors, medical administrators walk into Ministry of Health 6 times. If you really keep about 30,000, it's about 400 million per year, rupees per year. Imagine the cost. So that's why the systems approach, we have to look at just think outside the box and do a systems management. Now, what we have done now, we have already started linking all the hospitals and have these meetings over teleconference. Nobody has to come. It's only for a 3 hours meeting. We take about 3 days to come from Jaffna. So these are the things you have to really look at in future. So what are the components in the hospital? You have a patient care component, and then you have a support service component. The patient care component has the OPD care, investigative care, in-ward care, high dependence units like theaters, ICUs, etc. in ICUs. And you have health information units, right? And rehabilitative units and a pharmacy. And you have support services. There have been many. I'm just giving you some examples. The support service. You can't run the core service or the patient care services without the support services support, like administrative services, financial management, facility management. All these shall to come. Now, as I told you before, core services is the healthcare, clinical services, support services are extremely needed to run the core services. Look at the support services, right? Management of clinical services, general administration, right? Marketing and promotions, medical records are with them. Then the media, you have to handle media. Then central supplies and centralization division. Sometimes they will call CSSD, blood bank, infection control, quality. All are under administrative services. They will look at, but sometimes they might be under ancillary care as well, and legal. Talking to lawyers, legal requirements, all done by the administrative unit. And then look at the facility services, management, public relations, room services, you have to clean, janitorial services, laundry services, diet, right, landscape, security, transport, all that. Then the facility engineering, very important to run the facility. Civil, repairs done in the building. M&E, the mechanical and engineering, water and sanitation, electricity, air conditioning, sewer treatment plants, STPs, lifts, fire protection, gas supply, to name the few. Imagine the amount of support services or the facility services that you need. If you look at the clinical services, as I told you before, in a typical hospital, preventative care is there, investigative, curative, rehabilitative, training, and then, of course, the research. Training is a mandatory component, as so as the research. If you look at the OPD services, you can really go through this. These are the ones you generally do. There are direct services or indirect services. As per the new Nursing Now concept, organized in 2018 by the WHO and the International Council of Nurses, they really push all the nurses to go do outreach services, do home care, home investigation, patient transport, holistic care, public health services, all that will come in. Look at the investigative care, basic ones which are mentioned here, different types of investigations. And then in-ward care, daycare, primary care units, wards, rooms, and pharmacy. And then, of course, high dependency units, all this. And then rehabilitative care units. These are the many. I just gave simple points to understand. This is nice to look at. Now, if somebody requests you to answer this, discuss this statement, how to overcome the current obstacles in a hospital operational management by using general operational management strategies. And operational management, right, with a view to improve organizing the best run hospital in Sri Lanka. Just look at it, because your assignment also going to be something similar. It's nice to try to start writing, look back in your hospital, what you are doing now, and then go and see this particular, how to approach this kind of a question. So we look at the initially management process. Going back, we look at the management process. We define the management. Then we start looking at the management process. So we did the planning. We did the strategic planning. We did the operational planning. Now we are going to implement that plan. Right? We are going to implement that plan. How will you implement that plan? So implement that plan, we will look at the organizing of resources. Right? I'm going to do it in another presentation. And strategy evaluation. Once you implement the strategies, you have to evaluate the strategies, what is happening. We will be doing it in the monitoring part of it. Then strategic change. Once you do this beautiful plan, it will not affect, it will not be effective because we have to change the environmental organizational culture. So this will be done as change management. Going back, right? We looked at the initially we looked at the management, right? And management as with one management process has the planning, right? Organizing, leading, staffing, and then the evaluating or the monitoring. So what we did was we did the plan. The plan has two, strategic and operational plan. So we look at the operational plan, right? Then we look at then comes the strategy implementation, right? So implementation will be we will look at now in a while. We will spend more time on that, and then strategies has to be evaluated. How to do monitoring mechanism and find the strategic change. So we'll go into that in a while. If you look at the strategic evaluation, there are a few ways of evaluation. You have to look at the external evaluation by the consumer and the market studies. Internally, you can do audits. It could be a medical audit, right? You look at the quality audit or accounting audits. Then, we'll look at this in a while. Let's look at the organization. Now, organizing component is a part of the management process. We did the planning. Now we are going to organize, right? Now, planning, organizing, monitoring, and controlling. So we look at the organizing part of it. This is the lecture 3. The lecture 3. Antipika, right? Now, yeah. මේකත් ඕනේ නැහැ. චේන්ජ් එක ගැන මම කතා කරන්නේ. මේකත් ඕනේ, ඉවැලුවේෂන් උත් ඕනේ. ස්ට්‍රැටජික් චේන්ජ් කියන එකට විතරක් නැවතු ඒක මම කිව්ව ටික වෙනකන් ඇති. ඊළඟට දැන් මම ටිකක් කියන්නම්. So next step what we have to do is to look at the organization part. It will be in the lecture 3. Thank you. Have a nice day.